Welcome to Deny Delay Depose, Health Over Wealth. It's a messed up world out there, but we're here to talk about making healthcare a little less insane.
How is healthcare related to these military parades?
Well, hello everyone. Insane is putting it mildly, Jesus. I think the whole Mangione thing is just the tip of the iceberg, a sign that we're about to see a radical shift. But look at this parade happening while people are protesting in the streets. It's like, here's some tanks. Now shut up and deal with your denied coverage.
Hey everyone. I think both of you guys are exaggerating the degree of the negative impact of this. I mean, parades are a tradition, right? It's a show of strength and stability. And while the Mangione case is tragic, it's an isolated incident. Are we going to rewrite healthcare policy based on one person's actions? We can't just throw out the whole system.
An isolated incident? Sarah, insurance companies deny claims routinely. People are bankrupted by medical bills every day. How many isolated incidents until it's a pattern, a feature of the system? And that money spent on the parade, that could have funded community health centers. Healthcare access in rural areas isn't good. It could have paid to solve that. Instead, we have tanks and soldiers.
Exactly. And it's not just about the parade, is it? It's about the message that's being sent. We have power, we have resources, and we're going to show it off. Meanwhile, look at the approval ratings all over the place. People are divided and scared, and then Trump just decides to roll the tanks for his birthday. Mangione is a martyr.
Okay, Otto, slow down. Martyr? Look, the approval ratings reflect a divided country, sure, but it also reflects people generally accepting existing governance, and the economy isn't doing horribly. It's not like everyone's in the streets. Plus, the National Guard being deployed to LA, that's about maintaining order, preventing chaos. We can't just let protests shut down a major city.
Maintaining order or suppressing dissent? The No Kings protests are directly addressing this problem of prioritizing power over people, which is what's happening in healthcare. These rallies could be seen as a form of collective patient advocating. We're throwing money at the symptoms of a broken system instead of fixing the root causes that drive people to protest in the first place. Healthcare access is a big part of it, for sure.
And that root cause is profit. It's the relentless drive to squeeze every last dollar out of sick people. Look at this article, ICE shifting away from raids on farms and hotels. He won't deport workers as much because it might actually harm the economy. As long as it helps the bottom line. We need to focus on the needs, not the bottom line.
Otto, businesses respond to market forces. That's how the economy works. The fact that the administration is adjusting its immigration policies based on economic impact, that's just pragmatic. It's about balancing different needs and finding a workable solution. About maintaining an ongoing system.
A workable solution that still leaves countless people without health care. A workable solution that tears families apart and sends them back to dangerous situations. I tell you, a military parade and a workable solution don't hold a candle to a society in which people have their basic needs met. We're prioritizing punitive actions over preventive care in immigration and in healthcare, to put it bluntly.
Right, it's all connected, Jesus. The military parade, the protests, the approval ratings, the deportations, it's a power play. The military-industrial complex is preparing to play a larger role in healthcare governance and resource allocation. I think it is clear.
That's a bit of a leap, Otto. I get that you're seeing connections, but it sounds like you're building a conspiracy theory. The military has always been involved in disaster relief and national security. It's not surprising to see them involved now. It's a tool. That's it.
It's a tool being used to address the wrong problem. If we invested in things like mental health services, affordable housing, and universal health care, the need for that tool would decrease. We would need less resources. We are making it worse by not attacking the problem.
It all ties into generational trauma too, right? People are inheriting this distrust of the system, the sense that they're just cogs in a machine. And the healthcare system just reinforces that feeling. It's a cycle.
Okay, generational trauma is real. I'm not denying that. But attributing everything to it is overly simplistic. People have personal responsibility too. And our healthcare system does have some successes. We have incredible medical innovation, specialized care. It's not all doom and gloom.
Innovation that's inaccessible to most people because of the cost. Sure, we can cure rare diseases, but what about the millions who can't afford basic checkups or insulin? We aren't even tackling the basics.
That's exactly why Mangione's act resonates with so many. He's a symbol of that frustration. He felt powerless. This entire system that benefits only the few.
But violence isn't the answer. It just creates more chaos and justifies the very kind of authoritarian response you're both worried about. If you actually want to fix the system, you need to work within it. Lobbying, voting, policy proposals.
And how effective has that been so far, Sarah? We've been working within the system for decades and it's still broken. Lobbying is just legalized bribery. The healthcare industry throws millions at politicians to keep things the way they are. It is hard.
Okay, you're sounding really extreme. But let's say, for the sake of argument, that major change is needed. What specific policies would you advocate for? How do you pay for them without bankrupting the country?
A Medicare for all, a single payer system, cut out the insurance companies and their bloated administrative costs, negotiate drug prices, invest in preventative care. It's not just about paying for it, it's about reallocating resources and changing our priorities. That money spent on the military parade for starters. It is time for optimization.
Yes, and we need to address the underlying causes of poor health. Food deserts, lack of affordable housing, environmental pollution. Healthcare isn't just about doctors and hospitals, it's about the whole ecosystem.
But those things cost money too. And even with Medicare for all, you're still going to have rationing of care, longer wait times, and less innovation. Doctors might be incentivized to be even more greedy and unmotivated.
Rationing already exists, Sarah. It's called Can You Afford It? The current system rations care based on wealth. With Medicare for all, at least everyone gets a baseline level of care. And innovation isn't solely driven by profit, it's driven by human ingenuity and a desire to help others. Look at open source software.
And think about the ripple effects. If people aren't burdened by medical debt, they're more likely to start businesses, invest in their communities, and contribute to the economy. It's an investment, not just an expense. Also, a good healthcare system that optimizes people, so people can work more.
Okay, but what about the people who work in the insurance industry? What happens to their jobs? And how do you convince people to give up their private insurance plans, especially if they're happy with them?
On retraining programs, we can help people transition to new jobs in the healthcare sector, in public health, in community outreach. And honestly, most people aren't happy with their insurance. They're just afraid of the alternative because they've been told it's socialism or whatever. They are manipulated.
It's about shifting the narrative, framing healthcare as a public good, like education or infrastructure. It's not a privilege, it's a right. Also, what about the massive influx of military spending affect the future of healthcare funding? What is the point?
But rights come with responsibilities. If healthcare is a right, does that mean people have a right to demand any treatment they want, regardless of cost or effectiveness? Where do you draw the line?
There will always be difficult decisions, but those decisions shouldn't be made by insurance company executives worried about their bottom line. They should be made by doctors and patients, based on medical evidence and ethical considerations. AI will have a big role as well. We need to start now.
Exactly. It's about prioritizing people over profit. It's why the No Kings protests resonate, why the Mangione case struck a nerve. People are fed up with a system that puts their health and well-being last.
Okay, so a total overhaul is a bit extreme, but even I can agree that certain things need fixing. Like, how do we address the issue of algorithmic bias in AI-driven healthcare? If the data used to train the AI is biased, it's just going to perpetuate existing inequalities.
Transparency, open source algorithms, diverse development teams, continuous monitoring and evaluation. We need to make sure these AI systems are fair and equitable, not just efficient. The market isn't going to do that on its own. And also address the fundamental causes of these bad algorithms being so prevalent.
Yes, and address the social determinants of health. It's not just about having access to doctors, it's about having access to healthy food, safe housing, and a clean environment. The zip code you live in shouldn't determine your lifespan.
Okay, those are good points. But it's a massive undertaking. It is important to stay level-headed and not be drawn in by radical thought.
The alternative is to continue down the path we're on, where healthcare is a luxury, not a right, and where people are dying because they can't afford care. That's the radical position. We can't keep letting the economic impacts hurt our fellow humans.
And let's not forget about the mental health crisis. The stress of navigating this broken system is taking a toll on people's well-being. We need to invest in mental health services and make them accessible to everyone, regardless of income.
I can agree with that. Mental health is often overlooked. But we also need to be realistic about the limitations of the system. Healthcare isn't a magic bullet. People still need to take responsibility for their own health. But what are you supposed to do about it when you can't afford it?
Right, and how can people take responsibility for their health when they're working 2 jobs to make ends meet and don't have time to exercise or cook healthy meals, or can't even afford it? Systemic problems require systemic solutions. We're talking about generational trauma affecting all people. Let's fix it.
It is true. The mass deployment of the National Guard and Marines to handle domestic disturbances seems to be another potentially dangerous symptom of the profit-based healthcare system. It is repeating elsewhere in American society. We all have to be aware of what is occurring.
All right, I see your points. But the cost of the parade wasn't the real problem. It's that we aren't focusing all the resources and attention to fixing that system. Where do we even start?
Education, getting people to understand the real problems, mobilizing the medical professionals, making a big deal, putting faces to the issues, doctors, nurses, even healthcare administrators who want to do better. This isn't about hating the system, it's about changing it.
It is about restructuring to prioritize the needs of patients instead of corporate interests. What specific actionable steps can be taken to achieve that change? That is the next hurdle. It won't be easy.
Well, that's about all the time we have for today, but let's come back next week and find new ways to tackle our sick system. Remember to deny, delay, depose, health over wealth.
Yes, join us again next week for Deny Delay Depose. We'll see you next time.
See ya next week.